As the number of COVID-19 cases rise, Taiwan's nursing homes and assisted living facilities are taking steps to protect their residents, considered the most at-risk proportion of the population. Stephany Yang visited a Taoyuan facility to see what they are doing to keep the elderly safe.
Health officials say that older people are at higher risk of COVID-19. That's why senior villages in Taiwan are taking extra precautions against COVID-19. Staff at this assisted living facility is enforcing temperature checks and hand washing. Disinfecting the facility regularly is also a priority. The lobby is disinfected once every 2 hours. The elevator buttons are covered by protective tape, and this tape is disinfected every hour. In addition, the facility has also implemented new visitation policies. Residents are allowed only one visit a day by one family member who lives in Taiwan. Visitors who present a temperature of 37.4 degrees or above, or who have traveled in the past 14 days, will be prohibited from entering.
The first preventative measure we've implemented is at the entrance. All the doors are shut down except for one entrance. In terms of visitors, family members who are higher risk or who have traveled recently are prohibited from entering. They will be asked to use video chat instead.
If the seniors are feeling any symptoms of a cold or other symptoms, they'll be taken to a community hospital near the village. A thermal imaging camera system is in place to scan people. Anyone with a fever or other symptoms like coughing and shortness of breath will be taken to a separate room for a checkup. If they are confirmed to have COVID-19, they will be taken to an isolation ward. If they exhibit symptoms that aren't associated with COVID-19, they can visit a nearby community hospital to seek treatment.
There's a thermal imaging camera. If it detects that someone has a temperature of above 38 degrees, we will take some action, such as prohibiting visitors from entering and having them undergo assessment. In terms of medical help, there's a community hospital across from the village. We'll have Chang Gung doctors come here to help them. This will decrease residents' exposure to big hospitals. When relatives come visit us, only one person is allowed. It's pretty strict here. We feel very safe. These doors are closed, except for this small door at the side. I see the janitors wiping and cleaning.
Before entering the bus, seniors will have to take their temperatures as well as get their hands sanitized. If seniors want to leave the premises, they will take the shuttle bus. They're required to sanitize their hands. The bus is disinfected regularly. The senior village has also canceled events. The only exceptions are lectures that are held by health experts regarding the virus.
So according to current study, most of the people who actually got the progressive pneumonia, got the more invasive form of the respiratory diseases, are the old people and people with chronic conditions like diabetes, hypertension, cancer, or disabled patients. So those people are the high-risk groups. So the first is to have a strong sense of keeping a distance from people who have flu-like symptoms. And the second thing is that to keep personal hygiene, like I just said, wear masks, wash your hands regularly, and just don't go to crowded public spaces.
There's also a retirement community called the Shuang-Lien Elderly Center, located in New Taipei Sanzhi District. This facility has also placed restrictions on visitation. From January 22nd to April 15th, non-family members are prohibited. Senior facilities in Taiwan are taking extra steps to protect seniors from COVID-19. For Formosa News, Stephany Yang Formosa in New Taipei.